All right, guys, welcome to This or That. PA Gilbert, Dr. A, and we're talking about Ozempic butt today. So let's get started. So volume loss is a big thing. Gilbert, what you got for us?
Yeah, so the whole premise of This or That is to kind of talk about different treatment options from non-surgical to surgical. So from a non-surgical standpoint, in terms of volume loss, we love our Alloclae, and so Alloclae is our structural filler, fat filler that's going to help give some of that volume back to the patient without having to undergo a procedure like liposuction for fat transfer, which is what makes it really nice because it's a non-surgical option.
Right, and you've got great volumes there. You know, we've had people that have done 50, 100, even more cc's, but what if you need more? What if you've lost a tremendous amount of weight and you're trying to get, say, 400, 800 cc's? Well, then you got to come visit me, and we've got our BBL fat transfer, which we always know we love. We take that fat from places we don't want it and put it back here, and that gives us not just projection but also shape, and on the sides too, because when we place it, we don't just place it in one spot, we place it kind of strategically to get that beautiful shape you're looking for.
I love it.
Oh yeah. And next we've got skin laxity, another thing that happens with rapid weight loss, loss of collagen, thinning of the dermis, and of course just loss of volume, so you've got extra skin. And so what do you have for us there?
Yeah, so from a non-surgical standpoint, we have our Quantum RF, which is radiofrequency treatment, which maybe you're familiar with from like a microneedling standpoint, but this is going to take it just a little bit further. We are actually utilizing this device here, this Quantum RF handpiece. As you can see, it's got this nice long probe. We actually make a tiny little incision strategically, and let's say for the butt in this case, we would make it here in the crease where the butt meets the thigh. And then this probe goes underneath the surface of the skin, and it actually delivers that radio frequency energy just underneath the surface of the skin to really truly stimulate all that collagen production.
That's right. And of course you've got
our Avava laser, which we also love. And the beauty of Avava is that it can actually address two different tissue layers at one time in the treatment. So we would first address a deeper layer where we can stimulate some of that collagen, but the beauty is that we can now also treat the superficial layer of the tissue to help with things such as stretch marks, scars, different textural changes, making everything really nice and smooth, giving a really nice smooth contour.
Yeah, and so we really just try to think about this in all the terms, but let's talk about coming back to the surgery side. So let's say you're getting that BBL or you're doing something else in the OR, but you're looking for the maximal benefit possible. Well, that's where our Renuvion, our magic wand, comes in. And just like the Quantum, we make a small incision right at the crease. It's almost invisible, you can't really see it. It's really just, not even a 1/4 inch big, but then using that wand, you kind of go through the different areas and you get this really nice tightening effect. And I love Renuvion because not only do you get a fast tightening just from the helium, the RF energy that's being applied, but you get building of collagen over time. So 6 to 9 months later, you still got good results that keep on improving. So really fantastic treatment, really awesome. And even though it is a surgical treatment, we have done this on patients that are awake under local anesthesia, but it's something that we generally pair more in the OR because one of the surgeons has to do it.
That purple power.
Oh yeah. And lastly, we cannot forget our cellulite or contour issues. And so I'm gonna let Gilbert take this one.
So as you know, guys, cellulite is one of the things that affects a vast majority of our female population. And by no fault of their own, this is just truly a matter of these structural bands inside the tissue that are creating these little tethers, creating the dimples. And so we can use our lovely device Aveli here to go in and release those bands, which would then release that tethering effect, making the dimple much softer and smoother, and releasing that tension allows it to kind of smooth out, giving us a nice smooth contour.
Right, and so let's bring this back to the OR. How does this work in the OR? Well, this is a case where it's not this or that, but maybe it's both, because a lot of times we want that contour. So what we'll do is we'll pre-treat with Aveli, allow that space to relax, let that band release, and then we'll come in, use our ultrasound to target the exact perfect area to help that skin and that volume fill out with the BBL or with the Alloclae, or even sometimes with Radiesse or some of our other, kind of like atypical fillers to help get that shape. So sometimes it's not this or that, but both, and all the goal is just to give you the perfect results for that summer booty.